Initial assessment of a woman in labor. When a woman first comes to you in labor, your immediate responsibility is to find out whether her labor is progressing normally or if there are any worrisome signs. If any of these signs are found, it is safest to transfer the mother to a facility that can handle complications and perform cesarean sections, unless the baby is about to be born. This video will show how to assess our laboring woman and the signs that indicate the need for transfer. Start by gathering information. Help her feel comfortable by listening carefully, answering her questions, and treating her with respect. Check her antenatal record for any problems in her pregnancy and her HIV status. Ask her when strong regular contractions began. Have her waters broken? If they broke more than 18 hours ago, she is at higher risk of infection. She may need an antibiotic. Transfer her if her waters are dark green or if there is a foul odor. Ask about warning signs. Has she had bleeding from the vagina? Has she had bad headaches, visual changes, or convulsions? Has she had fever or severe abdominal pain even between contractions? If she has any of these symptoms, transfer her right away. This is the mother's first baby. She has had strong regular contractions since last night. Her waters are intact. She has no danger signs. Now, check the mother's vital signs. Measure her blood pressure. More than 140/90 is too high and can be a sign of preeclampsia. Count her pulse. The normal rate in labor is 60 to 110 beats per minute. Then, take her temperature. A fever is 38 degrees or more. This mother's vital signs are all within the normal ranges. If any are outside the normal range, you should transfer the mother. Now, examine the laboring woman. First, wash your hands. Be sure to maintain her privacy during the exam. Check for signs of anemia. Look for pallor on the inside of her lower eyelids and palms of her hands. A woman with severe anemia doesn't have a reserve. If she loses blood, it's best to refer her. Observe her contractions. As labor progresses, they become more frequent and last longer. Monitor their frequency and duration every half hour if possible. This mother is having 3 contractions in 10 minutes and each lasts a full minute. She is in active labor. Check the position of the baby. The baby is head down and facing in toward the mother's back, the most favorable position to give birth. If the baby is bottom down or sideways, or if you find twins, it's safest to transfer the mother. Estimate the progress of the baby by measuring the number of finger widths from the pubic bone to the base of the baby's head. It measures 2 fingers out of 5. This means the baby's head is engaged in the pelvis. If the baby's head remains high at 5 fingers above the pelvic brim, she could be obstructed and need referral. Now, check the baby's heart rate. Listen through a whole contraction. Count the beats for a full minute every 30 minutes in active labor and every 5 minutes when pushing. A rate between 110 and 160 is normal. If the baby's heart rate is less than 100 or more than 180, turn the mother on her side and count again. If the rate is still abnormal after 10 minutes, the baby might be in trouble. Transfer the mother urgently. Next, a vaginal exam may be done if needed to check the mother's cervical dilation. It's important that this exam be done with sensitivity and gentleness. Explain how it will be done and ask for her consent. Use sterile gloves. If needed, gently wash the genital area front to back with clean soapy water. There is no need to shave the area. Ask the mother to open her legs, but do not force them open. Wait until after a contraction. Then, insert 2 fingers inside the vagina. Find the cervix and estimate her dilation. This mother is 7 centimeters dilated. Now, record your findings. Let her know what to expect in labor and birth. Remind her to drink fluids frequently, empty her bladder often, and be as active as she desires. Let them know you will check on her often and be nearby if any changes occur. Remember, ask about the length of her labor, leakage of her waters, and danger signs. Check the mother's vital signs and contractions, the baby's position and heart rate, and if needed, do a vaginal exam. Be alert for potential problems to safely transfer the woman in time.